Thank you very much for doing that for me. I appreciate it. Hello, everybody. This is Brian Dowd from the Department of Community Health. I'm the Deputy Executive Director over Policy, Operation, and Compliance at the Department of Community Health. I'm also the business owner for EVV. Welcome to our May Town Hall presentation. We have been doing these presentations, so it's November, and I really want to thank everybody from the onset for being with us today and taking the time to continue to tune in to these monthly Town Hall presentations. We always start all our presentations with the mission of the Georgia Department of Community Health, which is to provide Georgians with access to affordable, quality health care through effective planning, purchasing, and oversight. So what are we going to go over today? We're going to do some status updates and timelines, just so you all know where we are in the process. We're going to talk you through some training resources, registration, some common issues and questions that we're getting. We're going to give you the information on the EVV call center. If you need to call in with any concerns that you may have, I want everyone to be aware of how they get in contact with our call center. We're going to do our third-party EVV vendor update, and then we're going to pause for Q&A. A lot of today's presentation is going to be designated for Q&A. We may or may not need it, but and that's fine if we don't. If we're ending early, that's good too. But we're going to go ahead and make sure there's plenty of time for Q&A. So let's start with our status and updates. So you've probably seen, if you've been in the other town hall meetings, you've probably seen these slides many, many times now. We did our provider registration back in March. We did our provider training, started on March 16th, and we were doing training before that because we've been doing these town hall meetings, and even before the town hall meetings, we were doing in person before the PHE meetings throughout the state. But we really started our intensive training as of March 16th. Provider registration was open on March 29th, and yes, we did have providers that registered on the 29th and the 30th and the 1st and have continued to register every day. April 1st, the system was ready with initial training complete, and we had our ongoing support in place, which included the call center resources. We're in May now, believe it or not. I can't believe it's already May, but we are in May. So this is part of that recruitment campaign I've been talking about. We want providers to get on board. We want providers to be registered, and we want providers to join the existing providers that are already using this system to capture their visits for their members. We're also doing system refinements. So the EVV mailbox, the call center, and the call center mailbox, and the call center chat line are all taking inquiries from the public, and anything that needs to be updated is being updated through those communication streams. As you all are also very much aware, July 1st, 2021, we do still plan on going mandatory for claims processing through EVV system. A couple of other things. We are working and continuing to test with third-party EVV vendors. If you as a provider have hired your own third-party vendor, we will have a summary slide at the end of this, but several of you all have reached out to me to say, well, we understand they're testing, or we understand they have a contract signed, but where are they in the status? I'm going to ask you to contact your vendor on that. Your vendor should be able to tell you where they are within the status, and they should be able to give you an update on how their integration is going. Also, for anyone on the call today who is consumer-directed or self-directed, we want to assure you that we are continuing to have bi-weekly meetings with the fiscal intermediaries. So every other week, we're talking to the fiscal intermediaries and getting them on board with the EVV process. So there's a multitude of training resources, and we want to make sure that you all are aware of those training resources. So they all are available on the DCH website. There's a training registration how-to guide specifically. They include modules, topics, length, training recommendations by role, step-by-step instructions for registering for training webinars. So we really want to encourage you to go to the website and take advantage of all of the different avenues we have for you for training, starting with the training registration how-to guide. We also have a multitude of other system trainings that are available. This is what the system training looks like. So when you have training registration, you can go here and it will give you all the clicks and all the places to go in order to see any of the training dates and ongoing trainings that are available for you. Again, all of this is accessed through the DCH website, and we'll have that information, and I'll tell you the quick way to get to it as well. Wait, I just took it out of there. Sorry, y'all. I just clicked on the link. That was bad of me. I hope we're back to the actual presentation.
We are, Brian.
Okay. Thank you for verifying that for me, Joe. So registration resources. So there are a ton of registration resources. It is highly recommended that providers registered and begin engaging with the solution now. I know this slide says at least 1 month before July 1st, 2021, but I'm telling y'all, it's important that you get registered now. We want all providers registered and all of their members, all of their employees set up and their members set up so that there's no issues as of July 1st. We don't want you guys scrambling around the week, 2 weeks, 3 weeks before we go live with mandatory claims processing. And then you all come to us and say, hey, we can't get paid. It's July 1st. We understand that, that's going to be a problem. And the best way for you to be able to work through that problem is to get registered as quickly as possible. So please do go to our EVV service provider page. The how to register a provider agency link is available on this web slide. It will give you the how to step-by-step. Also, we did a specific town hall that was specific to registration. You can go back in, look at those slides, listen to that presentation that we did, just like this presentation, and it gives you the step-by-step as well. So there's multiple avenues for registration resources. One of the big things that we did see as part of registration clarification was that there was a lot of confusion out there around IDs. And in Medicaid, we issue you IDs in a couple of different ways. We issue you a Medicaid ID specific to contracts. So for us, it may be that you have a CCSP ID and you may have a source ID if you are doing business in both of those contracts. If you're doing work in ICWP and you do work in the comp waiver, those are going to be two different IDs. Also, IDs are specific to provider location. So you're going to have multiple IDs. You need to make sure when you have those multiple IDs that you are using the IDs that are associated with PSS services or CLS services. If you also have an adult day health center or a community access group center, if you try and register that ID, it's not going to work because it's not one of the EVV services. You have to use your PSS and CLS IDs in order to register. And some of y'all have sent me screen printouts of a way that you can go into MMIS and just pull out all of your IDs. And it includes contracts and specialty codes that are associated with it. I encourage you to call the MMIS call center if you need help with that, or our EVV call center, and they will walk you through the process as they have done with many providers. Another very important point is your ID must match the So where you registered that ID, you must match the zip code to that location, the one we have on provider file in MMIS. Some of you guys have a central location that's in Lilburn. That's where I live. So you got a central location in Lilburn, but you have a satellite office that is in Alpharetta, and you got another satellite office that's in Cairo. You got another satellite office that's in Tolliver. You have another satellite office that's in Hayhide, right? Well, those are all separate IDs if they're all for PSS, and they all have to match to their zip codes as well. This is the same thing I just talked about. Y'all know I'm terrible with sticking with slides. I wish I was a lot better than that. Okay, third-party vendors. If you have a third-party vendor, a question we get a lot is, if you have a third-party vendor, do I need to register for the TELUS solution? The answer to that question is yes. You still need to register even though you have a third-party, you're utilizing a third-party vendor. The EVV visit information will be passed from your EVV vendor to the TELUS solution, so we'll get that from EVV. But you still need to be able to go in and utilize the TELUS Claims Console training. You need to be able to look at the administrative portal and do all of the things that are associated with the administrative portal. So you absolutely positively do need to register, even if you are using a third-party vendor. You've got Brian's EVV solution out there. You know Brian's EVV solution is working with TELUS, and they're already in testing, and they've told you, we got this, we're good. That doesn't mean you don't need to register. So please go on in and register as well. Once you do register, prior authorization and member data should be loaded from our state feed. You will need to add via manual entry or import your users or employees. If you have any data that is incorrect or not showing up, you just need to call the EVV call contact center that we will give you. We've seen several things with this. We've seen people say, hey, this isn't my employee, and I mean, this isn't my member, and the member's been an old member and they're no longer a current member. And that's because we've given a history of members to your agency. We've seen some, let's say that there's been no problems with your members showing up in CCSP and source, but when you get to ICWP, it doesn't seem like your members are showing up. If you have those issues, call the Georgia call center. You can write me too, but here's what's going to happen if you write me, the EVV mailbox, the normal EVV mailbox, and I'm sure some of you guys have already experienced this. I just forward it to the call center. I forward it to the call center and I give you all the call center resources for follow-up. Now, that doesn't mean that we're not tracking what's going on. We track all of the call center utilization. So whether or not you contact me or don't contact me, I still know what's going on in the call center. I know what the issues are. We're tracking everything. So you don't have to send it to both places. You don't have to send it to me and the call center. And the quickest place you will get help is through the call center. So other really important points, each location and service registration will need to have an administrator. If you are the only administrator and you change your role to biller, then you will no longer have administrative access. And you'll need to call the EVV call center for support. So the administrator is kind of like the super user. So you don't want to restrict your access below administrator if you're going to be administrator. And if you're the administrator and you want others to have that lower level access, then that's where you would assign the different roles to the individual people. So we've seen a couple of people where they've signed up as the administrator, and I think very logically they've said to themselves, you know what, I also need to be the biller. Let me switch myself to biller. No, don't do that, because if you do that, then you can't flip back to being the administrator. In a previous town hall meeting, we told you guys that the provider short name could only be updated during registration. That is not how it works. So we just want to clarify that. The provider short name cannot be updated during registration. Provider short name can be updated in the administrator portal after you have completed registration. So once you get through the registration and you're the administrator, then you can update your provider short names. You need to make sure that they're unique and identify waivers or locations. So whether you're saying PSS, to use my example earlier, PSS, hey, HIRUS, CCSP, right? PSS, KRO, source. So that way you know what each individual ID is, what it's connected to, which waiver and which location. And it should be in drop down from there. Hey, this is for the Alpharetta office and it's for comp. And I know that because my short name is, ALP comp, and I can just go to it. I promised you guys to give you the information on the call center, and here it is. And this information is also prominently on the DCH website, so you should be able to find it. But even if not, it's right here. It'll be in this presentation. We will post this presentation shortly after this training today. We'll go ahead and get it up on the website along with all the others. It's in last month's training as well. So if you were to click on last month's training and go to this slide, you would have it as well. So that's the phone number you got right there, 833-701-0012. We also have an email and a website for chat if you need to. On the DCH website, there is a cheat sheet that will give you how to reach who, like a contact flow, who does what, contact us type sheet. It's just a little cheat sheet, so you have it and it's available for you to use. Again, all of the town hall presentations that we have discussed are available both on the member pages and the provider pages of the DCH EVV website. All materials are available for both pages. I've had several self-directed individuals contact me and say, hey, I didn't see the town hall for self-direction. Are you all doing another one? First of all, yes, we'll be addressing self-direct specifically as we move forward in this process, and once we get the third-party fiscal intermediaries on board with the way that it's going to be administered. So we will be doing specific reach out by FI, but also those town halls that we did that were specific to self-direction, we did one whole month and dedicated it to nothing but self-direction. Those are available on the website now. So you can go back and listen to them. You can look at the slides. You can fast forward to the Q&A if you wanted to hear the Q&A. All that is available. Now, upcoming town halls. We want to talk a little bit about upcoming town halls. We are going to do 3 more months of these town halls. We're going to do, they're all going to be open Q&A and like this, for feedback. And what we're going to do is, what are we hearing the most from the field that we need to do? And those are going to be what we point them to. They'll be available the first weeks of June, July, and August. And these are the times we like to do one during the day and one at evening, because we heard that from the member and provider advocacy community very strongly that we needed an evening option as well. I'll be honest with you, the evening options are a lot less attended than the day options. It's usually about 1/4 of what we see during the day, but we still want to make that available for folks, and we will continue to do so. Finally, this is the one that I keep looking at because it gives me a lot of happy hope. So I think if you guys have been following us on these town hall meetings for a while, when we first started out, most of these third-party EVV vendors were in black. There were just some contact, but nothing really had been done. They hadn't signed up. There wasn't a contract in place. So there was some initial contact, but no contract. Then we moved to quite a few more that were in blue, right? That means we've got a contract on board with the folks in blue. And I think you can see those folks right here, meaning that they're saying, hey, we're going to move forward with this EVV integration, and they're ready to go, but we haven't yet got testing. The ones in green are ones where we're fully testing with those folks now. Sorry, take a drink. And as you can see, what started as 1 or 2 agencies that were full on testing has turned to a lot of agencies that are full on testing. So we've really, really moved forward with testing, and we will continue to update this slide periodically for you all to see. I do want to point out that there is one agency that has declined integration, and you'll see that here in orange, the Myra Healthcare Technologies. If you are using this as your third-party vendor, you will need to come up with a plan. Whether that plan is to just use the EVV system, the TELUS EVV system, and register, that is fine. Or if the plan is to call Amira and say, hey, what's going on here, that is also fine as far as getting integrated. But keep in mind, they will have to be integrated by 7/1 in order for claims processing to be done. So I just want to ensure anybody, and I'm not sure we have anybody who's using this Myra Healthcare Technologies organization, but we do want to be fully transparent and let you folks know we have heard from them and they're not planning on integrating. How to find information. This is the website for EVV. It's much easier for me just to Google DCH EVV or Georgia DCH EVV, and it's one of the top 2 that come up. You know it's our website because it always ends in Georgia and Gov for government. So you can just look down and see which one is georgia.gov, and it will take you to us. Also, evv.medicaid@dch.ga.gov. That will come to us as well here at the department, and we will respond to you. I'm asking right now that this week you all be a little patient with us. It's an extraordinarily busy week at the Department of Community Health. So it's very likely that many of the emails that have come in recently to that mailbox won't be answered until later in the week or this weekend. But we do answer all email inquiries that come into the mailbox. Every single thing that comes in gets an answer. Okay, that's it for today's town hall training. So I'm going to pause here and I'm going to let Lee Clois ask whatever questions there are in the mailbox. Again, we're going to leave this up in case you need to contact the EVV mailbox directly.
Hey, thanks, Brian. Can you hear me okay?
Yeah,
Yes.
I can hear you fine. I'm just keep touching my spinning wheel and it's messing up the slides. But okay, yeah, I hear you.
Well, stop touching the spinning wheel, Brian. Okay. So the first question we've got, good afternoon. Hope you are all doing well. My employees and myself are confused. We attended an Acumen webinar and they say we can use their EVV system for employees. Do we as employers use TELUS to schedule employees' time and add notes, or do we pick which EVV system we want to use? Our understanding is one or the other, but each system is really different. We have faithfully attended all WebEx sessions and are still confused. Thank you for your help. It is so much appreciated.
So this is a participant directed member. So let me address this from participant direction. So when you're in participant direction, what essentially it is that you have a third-party vendor, and your third-party vendor is your fiscal intermediary. So we're going to be looking for you to utilize the fiscal intermediaries system, not the TELUS system, but the fiscal intermediaries system. As far as scheduling goes, I've heard from many folks that they don't do schedules. You should be required, you should have a schedule. So having a schedule is a requirement of a waiver program. I understand that the DCI system does not utilize a schedule in their system, but you should still have a paper copy of that schedule or another electronic copy of that schedule for documentation. That is a requirement. any notes or documentation that are not captured by the DCI system, you need to make sure that you're still capturing so that you have the information that's available. If you or your employees still have questions, I would encourage you to utilize this mailbox and write me. You and I will have a one-on-one. So you and I will specifically sit down and talk and discuss and make sure that you are 100% clear moving forward. So let me encourage you to do that, okay?
All right, thanks, Brian. Next question. The services are not showing up on the app, and the T1019 modifier says UC, which is wrong. So, Joe, you responded saying, if you are using the TELUS app, please submit a ticket via support.
Correct. Yeah, if that's something they're seeing in the app, then we'll need the details of that issue so that we can escalate it and get it fixed. So they would enter that through support, and then we would handle it from there.
So thank you, Joe. So let me just say that in a different way. Call the call center or email the call center in the information we gave you. Let them know what you have on your PA that is specific to PSS that you are not seeing in the system, or CLS, whichever service it is.
Okay, thanks, Joe. Thanks, Brian. Next question. This presentation is not for self-directed, correct?
So this is something I've addressed on a couple of calls, and I want to address it again because I'm getting a little bit of feedback. Don't mind muting. I don't know. You know, me and your computer have a long history of issues. It makes tons of weird noises that nobody else's computers do. So all the presentations are made available for everyone. Yes, we do have specific things that we are doing for self-direction. But as many of you guys know, I've been doing this quite a long time. Before I was in my current role, I was the waiver program director. And one of the things that I have continued to hear over the years is that we didn't make enough information available to self-direction. So I'm making everything available to self-direction. And in your self-direction, in your self-determination and self-direction, it's up to you to look at the presentations and decide whether or not you want to utilize the information or not utilize the information. No presentation goes by where we don't talk about self-direction in some way. Yes, we do specific breakouts that are only for self-direction, like the town hall that was for self-direction. But I don't know of any presentation where we haven't addressed in some way or form self-direction, even if it's just talking about where we are with DCI and that integration, or the first question we had today. So I'm reluctant to tell any self-directed member, you don't need to pay attention to this, because I think that's really up for you to decide in that spirit of self-direction, that you make the determination and your family makes the determination as far as what you want to utilize and what you don't want to utilize. What I'm going to do is make everything available to everybody.
Okay, thanks, Brian. Next question. I have tried to register, but it will not accept the information that I enter. I have called and emailed with no success. Joe, you responded with, please contact support and they can verify the correct numbers to use for registration.
Yes, that is correct. And support has been doing a good job helping the providers. They do get a little confused on the Medicaid ID and the, I forget what the term is, Brian, the numbers at the end that designate the different programs. So if you call support, they can help you with the correct numbers so that when you enter them, everything will work.
I'm not sure I know what those are called. I know they have a name, but it's like your A, B, B, C number. Let me say this too. If you feel like the call center is not being responsive and you've called the call, because what I hear you saying is you called the call center and the call center hasn't responded or been able to answer your question. If there's been a significant period of time associated with that or multiple attempts, you can feel free to email the evv.medicaid@dch.ga.gov email, and I will follow up with that. Now, if we find out you haven't called the call center, then I'm going to follow up with you about that as well. So please do your due diligence to take the appropriate steps, contact the call center first. But like with anything else, and like with your members who contact us when they have problems with you, you're welcome to contact the department and we will address the concerns.
Okay. Next question. Do I have to do this if I use Acumen?
I think we've answered. That's a self-direction question.
Yep.
We've answered that one.
All right. The next one, we've registered and one of our source clients is not in the database. Whom do we need to contact? Customer support did not know where to direct this issue. Joe, you responded, you did the correct thing by calling support. They will do the research and follow up. But from what I'm seeing is that customer support did not know where to direct this issue. So wouldn't they have closed out this ticket, Joe?
So it does depend on what the issue is. It could be, the root cause could be a variety of different things, right? Maybe the recipient didn't come over in the feed yet. Maybe the date is associated with a different Medicaid ID. So there are different root causes. So that's why support has to investigate to identify the root cause and then get back to the provider.
Yeah, so I want to be a little clear with what I said because I'm getting private chats and other emails that are associated with this as well. So again, tell us, just like you guys as providers are a vendor to the Department of Community Health, you work for us, right? You're contracted to work with the Department of Community Health. So is TELUS and Conduit. They're contracted to work with the Department of Community Health. So if you are having issues with the call center or otherwise, the appropriate and professional place to address those two is to the EVV Medicaid at dch.ga.gov mailbox. Again, we would expect you to do your due diligence and do things appropriately and send it first through the call center and get ample amount of time and able to address it. But if the call center says, hey, we can't help you, you need to contact DCH, then you immediately need to contact DCH through the EVV.Medicaid mailbox, which many of you are telling me is happening. So, excuse me, if they do tell you to contact us, then contact us. If you're just not getting the response you need, you can contact us as well. We will investigate that, just like we do if one of your members contacts us. We do the exact same thing as you being a provider. So you are afforded that same responsibility. So please do that.
Okay, thanks, Brian. Next question. What happens if case managers haven't updated or renewed a prior authorization prior to a shift beginning? Or if the member is experiencing a temporary problem with their eligibility when a shift occurs, will the system allow the member to have visits during those times?
So just like now, you have to have a PA on file in order. I mean, you can deliver visits. It doesn't get rid of our issues with eligibility. TELUS doesn't get rid of our issues related to eligibility. It didn't address anything with what we think of as PMAO clients or needs to update PAs. So we'll need to have those PAs updated and corrected and sent over to TELUS, or eligibility issues sent over to TELUS.
Brian, can I add to that?
Absolutely.
Okay. So again, this is just for if you're using the TELUS system. I can't speak to how a third-party application would work. But if you are doing visits in TELUS and you want to schedule a visit for a client of yours that does not have a PA in the system yet, you believe there is a valid PA, or obviously you wouldn't be providing the service, but it just isn't in the system yet. The system will allow you to do that. It will give you a message during scheduling, letting you know there is no PA, just in case you're not aware. And then you can go ahead and provide the service in EVV. It will record the visit. Then it will come back into the work list. It will go and look for that authorization. Obviously, if it's not in there, it won't find it. Then it will create an error, which you'll be able to see, and it will say prior authorization not available. Once the prior authorization does come over into the system, because as we've said, we're loading new authorizations on a daily basis. Once it's loaded, the system every so often goes out and looks for new authorizations that are coming in, and if it finds it, it will match it for you. But you will not be able to submit a claim until you have a valid authorization. So again, you can complete a visit. You cannot submit a claim. Hopefully that provides some clarity for that one. That's an important question.
Okay, thanks, Brian. Thanks, Joe. For this next one, it looks like the provider was attempting to make an update to some information in the provider agency screen, but they got an error message that says cannot delete or update object because it is already in use in other entities.
Yeah, I would need specifics. So again, I would ask that they file a support ticket. I don't know what they were trying to delete, but that is true that, like, for example, the caregivers or the aides are in the database, and it's very possible that aides work for multiple different agencies. So you cannot delete a caregiver because they're in our database. You can unlink them from your account, but you cannot delete them. So that I don't know if that's the use case that this question is about, but I would ask that this provider again submit a ticket so that we can help them with their question.
Okay, thanks, Joe. This one, could you please clarify if skilled nursing needs to be done in EVV?
It's just PSS and CLS.
All right, for this one, we understand that CLS is the only service that is impacted by EVV at this time. We use Acumen Fiscal Agent. Will we be allowed to continue to submit paper timesheets for all other services, or will we have to electronically submit the other services the same way as CLS?
So the authority of EVV is specific to CLS and PSS. We'll take that back to Acumen and ask them. I would encourage every single self-directed member to utilize electronic tracking of their services they provide. But that may be a decision that the department makes shortly. Thank you for that question.
Okay. Next question. We emailed the email provided for questions for TELUS EVV. However, we haven't had a response. I'm assuming they're speaking of the call center. Our main questions are, will timesheets still be mandatory for audit, or can we just print visit confirmations from TELUS? Also, steps we need to take if caregivers can't download the app to clock in and out, or don't have service in and out to verify visits. So rolling back to the top, will timesheets still be mandatory for audits?
So anything that is covered by EVV does not have to manually be printed. Our auditors can look in the EVV system. And if it's not captured by the EVV system, then you need to be documenting it elsewhere.
Okay. Next question. Can you have more than one administrator? Joe, you responded, yes, currently there's no limit to the number of admin roles that you can add. Okay, another question, should we expect more info and training from Acumen?
Yes, you will get more training from Acumen.
Question 2, the TELUS system currently doesn't allow the import of all the user role types, for example, billing scheduler. Joe?
Yeah, I saw that one. I would need to follow up on that one. It sounds like they are trying to use the import feature, and they're having problems when they go to name a role, a biller or a scheduler. So I will need to look into that one.
Do you want them to go ahead and submit a ticket for that, for tracking?
Yes, please.
Okay. All right, then we've got can a person be an administrator, biller, and a PCA at the same time?
Yeah, I'll take that one. It is possible. Obviously, we don't see that very often, where you're a caregiver, you're a scheduler, and you're an administrator. Now, obviously, in a very small agency, it is possible. Again, when you assign roles, we do give warnings that, like, for an example, an administrator is going to have access to PHI across your entire agency. So you just need to be aware and manage that properly. But there is no limitation for that within the system.
Okay. Next question. The user permissions are problematic in that you have to provide provider admin rights in order for staff members to add new employee users or clients. Also, you have to provide full billing capabilities for a staff member to see prior authorizations. Not necessarily a question, but do you have any feedback for that one?
I mean, I don't in general. No, I don't know. Do you have any thoughts on that one, Brian?
No, that sounds like a system enhancement, something they would like to see the TELUS system do better. So it's certainly something we'll take a look at.
Okay. Is Continuum considered a third-party EVV?
Yes.
Yes. Okay. This next one, would it be possible to install the app on a tablet and you guys provided something to take a picture of, or a front door, something besides my child's picture? Can we use an object in the home? My child cannot enter a code. I'm not always here when employees change and they don't want to use their pictures of their daughter or use of facial features. What are the options?
Thank you for this question. We've addressed it a couple of times before and in the previous self-direction town hall meeting, and we've also addressed it with Acumen directly. You do not have to take a photograph of your child for clock out. That is simply one option that Acumen gives you for checking out. But again, I want to be clear about that. It is not a requirement. In an instance where your caregiver is leaving, and the member is incapable of signing out in the Acumen system, and for whatever reason, no family member is around at that time, I'm assuming they're going to another service because I would assume we wouldn't just be leaving the member alone or alone in the community. But in the instance where, like, let's say they're going from CLS to CAG, in those instances, the system has the ability to override that checkout, and you don't have to enter a PIN if the member is capable of entering a PIN, and you don't have to take a picture. So that is not a requirement.
All right, one question. Can we give training pay or holiday pay? If so, how would we do it?
No, we don't have the ability, and we have discussed this with CMS, to pay for holiday or training pay.
All right, sorry, this is my first meeting. When is the go live date for home health? Also, I am confused. Are we sending our claims through TELUS or just the EVV? We use a clearinghouse to send our claims to Medicaid. Are those now to go from the clearinghouse to TELUS?
Home health is in 2023, so it's not right now. And if you want to write this email directly, we can address your concerns as far as the home health concerns. All claims will go through EVV for CLS, PSS, and eventually through home health. They will not be billed directly to MMIS upon implementation.
Okay. We have several missing recipients on the Fortella system. EVV call center instructed me only Medicaid has access to add a recipient. They do not have access. Who should I contact to add missing members?
So you can send that to the EVV mailbox and we will research it. If the member is not Medicaid eligible, they won't be added though. We'll probably need to do a little bit of research on, add this member and what that means. Okay.
Okay. Do employees have to be loaded as users if we use a third-party vendor, ClearCare?
I can take that one. So I'm assuming that the question is, do we have to load the users in TELUS if we're using a third party? And the answer would be no, you do not have to load your employees in TELUS. They will come over in the feed. So you do not have to load those.
Okay. I tried to schedule for testing purposes, but I could not find the option. Joe, maybe you can talk about where to find training.
Yeah, it says testing. So I'm not sure if that is meant for training or testing. So we don't have a testing solution, if you will. If it was, I tried to schedule for training, then all of that information on how to do that is on the website. And it is, if you go to fortelus.com, there's a big button right on our homepage about how to schedule for training as well.
Yeah. Okay. And there's also training. If it is specific to how to schedule, like how to use the solution to schedule, and you're not able to find that, that there's training out there for scheduling visits as well.
Mm-hmm.
Okay. The next one, hello, how do you create the short name?
Sure. So if you are on the portal, on your provider portal, and on the left menu tab, there's an item called provider information, and you click on that, you'll see the short name, and that's where you can edit that short name.
What is the role of the caretakers? How do we train them? Is it just downloading the apps to their cell phone? How about the guardian or client role?
Brian,
So,
do you
yeah,
want to take this one?
I think you would utilize the training resources that are available online. I'm not sure if that's a self-directed question or a traditional question. It could be either, but my answer would really be the same. The guardian or the family member or whomever would need to be aware of EVV, just like they're aware of services that are being delivered now, whether or not they're emergency response system or home delivered meals or community access group or whatever. We would expect that person who is an authorized representative to understand the book of services and get what's going on. EVV is another component of the waiver. So we would expect you to be aware of it, and that the actual caregivers will need to be trained on the system utilizing the multiple training resources, which is essentially how to download it to their app and clock in and clock out and take those necessary steps to be EVV compliant. Thanks for that question.
Okay. Are live-in caregivers included or exempt from the EVV mandate in Georgia?
They're included if it's CLS or PSS.
Okay. If an employee works for two clients who are under different IDs, do I need to input that same employee in both IDs or only once?
I can take this one. So again, I'm assuming you're using TELUS. I can't speak to how this works for third parties, but when you enter an employee, the first thing you do is enter in their full email address or their phone number. And then the system searches to see if that employee or that user is already loaded in the system. If it is, it will find that information and that profile, and will provide you a choice to select and invite that user to your agency. If they've not been loaded, then you can go ahead and create a profile. So you do not enter in, you do not re-enter in and create a new profile for somebody that's already in the system. So hopefully that answers that question.
Okay, thanks, Joe. All right, should we add users to TELUS, or would those be added by our third-party vendor?
Yeah, I think this was somebody previously asked this. So you do not need to enter users if you're in TELUS if you're using a third party. They'll come over in the integration.
All right, who do we address, I guess, who do we direct billing questions to?
We would need more information on that, but anybody is welcome to send any question you have to the EV mailbox. I will directly respond in writing to your questions. I've responded to over 1,000 of your questions already, so I can directly respond to that question. And that way it'll open a communication as far as billing questions or whatever else. If we need to direct you to the policy specialist because it's outside the purview of EVV, we do that as well. So just feel free to utilize this email box.
Okay, I'm just going through some of these. There's some providers asking if their EVV vendor or third party has signed up yet, but Brian showed one slide that will be provided later that has that list of all of those that have and some of where they are in the stage. And then we also have the information on the website as well. So I would suggest going there to see the status of your vendor.
Yeah, that's the information that we have, but I want to reiterate what I said in the town hall presentation. You need to be contacting your third-party vendor. So if you have Brian's EVV system, you need to be in contact with them and asking them where they are in the process.
Okay, one question. We already use DCI for time input for self-directed. However, what is the next step for facial recognition?
I think I already addressed that earlier.
Okay. When creating a schedule, how do you put a staff member in just for every other weekend?
Yeah, I can handle that. Again, assuming this is TELUS. There in the last step in scheduling, you can set up reoccurring visits, and there's tons of different options. Again, in training, we go through all of this. But quickly, if it's every other weekend, there's an option to select daily. You would select if it's every other Saturday, you can just select Saturday. And then it asks you how many times do you want to repeat this, how many weeks, basically. So if you want to do every other Saturday for the next 4 weeks, you would click daily, click Saturday, and enter 4, and hit save.
Thanks, Joe. I am working with support to make sure our members and authorizations are accurate. What will be the solution for new members or member whose authorizations are renewed but are not entered into TELUS? Will we be able to bill for previous services provided once the member or authorization is entered or connected to our company?
Yeah, so as Joe said, we'll get a daily feed of PAs where they're updated, and then you can bill through the EVV system.
All right, there's one question here for alternate EVV vendors. Where are the current specs located? Thank you.
They're located online on the DCH EVV page under third party. You'll see them on that page.
Okay. Do we have to use a different email for every ID?
I think the question is, do I need to use a different email for every user I load? I think that's what they mean, because we have heard this before, that users may not have emails and they want to provide one email for everybody, like a company email. So we do need a unique email or a unique phone number. So you do not need to provide both. So if you don't have a unique email, you can provide a unique phone number.
All right, thanks, Joe. There's several questions in here about their specific programs. Joe, do you want to tell them what they should do in that case?
I'm sorry, Luclos, I'm not sure I captured that.
Essentially, there's instances where the providers aren't able to register.
Mm-hmm.
They're not able to register. They're not able to register their programs, or none of their individuals have been uploaded to the agency. And I believe in a lot of these cases, we've been asking the providers to submit a support ticket to call the call center.
Mm-hmm.
We can help and research that. Is there anything you want to add to that?
So first, I'll just say a lot of providers have been able to successfully register, so we're confident that the system is working well. Mm-hmm. There have been a few providers that don't have the right Medicaid ID number to enter, and they're a little confused. So if they call the call center should be able to help them live on the phone and get them the right number so they can go ahead and complete registration. Was there a second part to the question?
Nope, I think that covers it. That was about 3 questions in one. So I'm just scrolling through now. I know it's 1:57 now. There's several other questions in here. Brian, would you like us to just kind of capture these questions and go through them and see if we can use any of these to update our FAQs?
Yes, absolutely. And I want to also let folks know on the call that I am interested in all your questions. And I'm interested in bringing clarity through the process. So, and getting us to an understanding. So again, if you did not get your question answered today, utilize the email box that has been on your screen now for about 35 minutes. If you'll just if you'll just send your question in there, you will get an individual written response back for your answer. You'll get, and most of the time it comes from me. Again, give me a little bit of patience. This week is incredibly busy with a bunch of different projects, not just EVV. But you will get an answer to the question before next week. So please do send those questions in to you. We'll take a multi-pronged approach to dealing with them. We'll include them in FAQs. You can write me directly. Again, you look at the FAQs that are out there now, because a lot of these questions will be answered on those FAQs out there. Please utilize the existing town halls, including the Q&As, because we're hearing a lot of the questions that we've addressed before. So you can get your answer already on our website. But if not, and for goodness sakes, I encourage you to go ahead and email me directly and I will respond to you. And one last thing before we close out for the day. I do want to thank everybody for attending and all of their thoughtful questions. I also want to encourage you, and I've been doing this since November, if you need to schedule time to talk to us directly, we are happy to do that. So far, I've only had 2 people take me up on this offer since November. But we will sit down with you virtually, of course, since we're still in the PHE on a federal level. But we will virtually set up a meeting with you and go through all of your questions and answer all of your questions. We are more than happy to do that, so you're not having any unsure points of clarity. So that's it. I want to thank everybody for your time today. We will have the meeting tomorrow night if you want to go ahead and sign in for that one as well. I hope you have a good rest of your week, folks.